Hello, my name is Dr. Wesley Willeford. I'm the Medical Director of Disease Control here at the Jefferson County Department of Health.
Hi, I'm Dr. Brittany Sanders, Lead Nurse Practitioner of the Specialty Clinic.
We wanted to talk to you today about the concept of sexual wellness and how important that is to a person's well-being and to their longevity. But to start, we want to give the definition for what sexual wellness is. Sexual wellness is a state of physical, emotional, mental, and social well-being as related to a person's sexuality. It's feeling comfortable in your own skin. But part of that is being able to keep up with the necessary sexual health screenings that are recommended.
The United States Prevention Services Task Force recommends annual screening for gonorrhea and chlamydia in women up to age 24. They also recommend annual HIV screening for people 15 to age 65.
A very important part of that is screening for eligibility for PrEP, or pre-exposure prophylaxis, for the prevention of HIV. It's a once daily pill that dramatically decreases the chances of acquiring HIV. Another set of screenings that should be considered for people who are sexually active is screenings for syphilis. But a group among the people who are sexually active that's even more important are people who have just become pregnant. People who've become pregnant should be screened for syphilis at entry into care, at the third trimester, and sometimes at birth, depending on how much syphilis is circulating in a local community.
There are 3 vaccines that are recommended for your sexual health. The first one is the human papillomavirus, or HPV. You may have received this vaccine during childhood, but if you didn't, men and women can get this vaccine up to age 45. This vaccine decreases your risk of cervical, head, neck, and anal cancer. The hepatitis A vaccine is also recommended for men who have sex with men, people who are homeless, and IV drug users. And the hepatitis B vaccine is recommended for people who are sexually active, people who had a sexually transmitted infection, and men who have sex with men.
One thing we want to do with this video is to put into perspective the numbers of sexually transmitted infections that are currently going on in the state of Alabama. In 2018, the Centers for Disease Control released a large report talking about overall numbers of sexually transmitted infections. In Alabama, we had the number 15 for cases of chlamydia in the entire nation, number 4 for gonorrhea, number 17 for primary and secondary syphilis, and number 25 for congenital syphilis. This really drives home the point of how important screening for these conditions are to improving the health of our community.
If you need a confidential sexual health visit, please call us at 205-930-1175, or you may visit us at jcdh.org. These visits are available for minimal cost and are located in the Sexual Health Clinic at 1400 6th Avenue South, Birmingham, Alabama.
Here at the Jefferson County Department of Health, we are committed to empower the residents of our county to take charge of their sexual wellness and be a good advocate for their own sexual health. Thank you.